Welcome, everyone. Kiiza Mwisiga is my name. I'm a psychiatrist and senior lecturer at Makerere University. I'm also a postdoctoral fellow for MQ for Mental Health for Research, who are the funders of this podcast. So I'm usually a guest. I'm not always a moderator, but for today I will be the moderator. And we have two lovely ladies who will introduce in a bit, but I will just give you context of why we're here. So many years ago, there was a gentleman called Brian Chanley, and he had a very severe mental illness called schizophrenia. And one of the things he did was that he drew his life and his symptoms, unfortunately, just before he ended his life by suicide. Learning about Brian Chanley, I realized that sometimes we underestimate patients and their ability to describe what they are going through. And so I was actually intrigued. Years later, I read about him in medical school. Years later, I became a researcher, and I started doing research in first episode psychosis. And one of the biggest issues was that I felt we never used to capture what people say. And so I thought, well, what would happen if we got them to tell us their experiences? And many times people say, let's do qualitative research, let's go record them, ask them questions. But Jakie Lydia here, who will introduce herself again shortly, said, well, no, there's a better way of doing things. Actually, people can draw their experiences, write about them, and tell them. So today we're here, fully sponsored by MQ, Mental Health for Research, and we're going to tell you about the draw, write, and tell technique that we've used in our study. I have a LinkedIn post where I showed our first picture. So this picture is our first picture. This was an actual patient drawing about the experiences, engaging with mental health services. I can't take a lot of credit. For this. So I have two experts here who are going to tell us about it. On my right is Jakie Lydia. On my left is Ritah, and I'm going to let them introduce themselves, and then we go back to what we wanted to talk about. Jakie, you first.
Okay, thank you very much. My name is Jakie Lydia Namukoli Semata, and I'm a psychologist by training, but a social scientist, senior social scientist. I've done a lot of research, mental health, infectious diseases. So that's all about me that I can say right now.
So many people struggle with psychiatrists, psychologists. So I like my shirt.
Yeah.
Ugandan psychiatrist.
No, mine
But
is
but she's a clinical psychologist. I think it's important to say that we work well together. Many people think that psychiatrists and psychologists don't work well together. But we're all important, and we all do important things. But yes, you are the brains of this operation because you're the expert. You didn't say that. You're the expert in draw, write, and tell technique. But we also have an expert in
being sick.
Not being sick, experiencing and drawing. So this is Ritah. Ritah drew her day today, right?
Yeah.
I told you a joke before we came on that for me, they used to use my art pieces to show people what not to do. So I can't do this. But Ritah, tell us about yourself.
Hi, my name is Auma. I am an author of 2 books, a passionate mental health advocate. I am a person with lived experience consultant, and I also run an organization called Heart to Heart Spaces. We're all about advocacy, helping people get the help that they need. And we also run the mental health run that happens every year. So that's me, and I'm excited to be here.
So I must say that I've known Ritah for close to 10 years now. And people always ask me, but why do you like Ritah? And I think I like Ritah because she understands what it means to show up, right? For a purpose. And I think she's represented the lived experience space well. So Jakie, draw, write, and tell. So I think briefly what we are trying to do is that we're trying to figure out why people come or don't come to the hospital. That's in our funded study. Again, shout out to MQ, Mental Health for Research, because not many funders at the time, now I think it's people are picking up on it, but not many funders at the time could have taken the chance on what we're suggesting, because we're suggesting to get patients to draw their experiences. Okay, so I would like you to tell us a bit about draw, write, and tell technique. Yeah.
Okay. Thank you very much. So the draw, write, and tell technique was really started in the 1980s. It is a qualitative participatory research method. That time it was really used in children mainly.
Okay.
But then it evolved into being used with the adults, and also because of the way it is, it's in the way you hear the word participatory. So the person or the participant you're speaking to is directly involved, and it takes on the shape of what it is called. So the draw, which is drawing something, then the tell, which is optional. You tell us something about what you have drawn, and then it has the the writing. Yeah. So the writing is what is important, because then you tell us.
Okay.
Yeah.
So the writing is optional, then the telling is
yeah.
So the writing. So I've actually seen a few of this, and I think I like the fact that it's actually participatory.
Yeah.
Because the way we do it is that similar to what you did today. So so we actually tell you draw about so today we told you to draw about your day.
Yeah.
Coming for this podcast shoot, right? And then you write a few things about it, and then you tell us about it. And in there, it allows us to, get a lot of in-depth understanding. So where we are trying to understand why people come to the clinic and stay in the clinic. So they draw a lot of the experiences around that. But maybe we should do it practically, because we actually have
Okay.
a lived expert here.
Yeah.
We
Yeah.
have a draw and write and tell expert here. And we have a drawing. Again, I could never draw something like this.
And writing.
I was the best at doodling. When it comes to doodling and coloring, that one I get full marks. But yeah. So how would it go? Maybe you could tell us exactly what happens. Yeah.
Yeah. So using Ritah's picture that she drew for us today, the first thing I did was to prompt her to draw for us her activities from the time she woke up until she got here. And this is what she was able to put up for us. And then she also, which is the drawing, and then she wrote something. Like if you look at the pictures, there are some things that she wrote down, and that is really optional. The telling, which is the most important part, is what she's going to do for us right now, because the pictures are here.
Oh, okay.
Yeah, so she can just...
So does she tell us, she tells us about her pictures
Yes.
and why she drew it and why she selected it?
Yes.
Okay, that's cool.
Okay, so the first picture has me waking up to pray. I woke up feeling very low, and I didn't really want to do anything. So I set my alarm for another hour, gave myself another hour. Then I was like, okay, now we have to do. So I woke up to pray to ground myself. And then I took some warm water for my digestive system to kick in. And then I proceeded to work. I did like 2 things out of the 8. Because when I'm going through a low, I pace myself according to how I feel. I don't over push myself. And then it rained, and I had to come for my shoot in the rain. Yeah, and now I'm here.
Yeah.
So that's my day.
And I think I find that very interesting because in there, and you're a clinical psychologist and as a clinician, you could tell that there are so many areas to explore, right?
Yeah.
You could explore spirituality, which is important for well-being. You could diet, clinician, you're asking, what are you eating? Why are you eating? Why do you need water? She talked about a low day, right? So it goes back to what I said in the beginning. It's just amazing how mental health does not realize how much information there is. And I think for me, that's the thing that I find very beautiful. And maybe, I don't know, Ritah and Jakie, Lydia, you could tell me, do we capture, in the way we do it currently, where we get a checklist, and do you feel we capture experiences well enough? Because this, for me, is better than any tool out there for capturing like a patient's day, right? So do the tools we have right now capture to this depth? I don't know what you people think.
I actually don't think they do. Like, until I drew and I was going through the day, so when I realized, okay, I went through different types of emotions throughout the day. I actually had a moment to recognize the emotions and the different things I went through up to my now. And yet, if I was seeing a psychologist for a normal session or a psychiatrist and they asked me, how are you? I'd be like, okay, I haven't been
I'm
sleeping
low.
well. But I wouldn't go into the detail of today. I was low.
Yeah, and you wouldn't, maybe we wouldn't capture well all these aspects,
Yes.
So if you say you're working, but you're doing a quarter of 2 out of 8, which is about a quarter of the work, right? So, okay, you as a draw and write and tell expert, what more do you think we can capture? Because I feel we haven't captured, we've like scratched the surface.
Yeah. So as we can see, there are only 4 pictures clearly, but starting from the morning, from the prayer. One is the insight that we talked about. Like if she hadn't told us, that's now the telling part. We would look at the picture of someone praying, but we cannot interpret it.
Okay.
But then she gives us the interpretation through the telling, and it's in-depth. There are very many things around that you cannot capture in just an interview. Even if I was to use a qualitative method, I call Ritah here and I ask her questions, most of these wouldn't have come through.
Okay.
And as she's drawing, she has these feelings, these emotions that she's thinking about as she draws. And all this enriches the pictures that are being put on the paper. So it's not just about the drawing, but the story behind that drawing. And Ritah's pictures are quite elaborate and very good, but someone else wouldn't even draw this. Because it's not about a perfect picture. It's just the story behind that picture, what that picture means to you.
So I, who can't draw to save my life, can still use draw, write.
Yes, you can still use the draw, write, and tell. Yes.
Again, at this point, I really think, and the more I think about it, I really need to thank the funders, right? Because many times when people go to review funding applications, they are looking for the safe bet, right?
Yeah.
They're looking for, you have 1,000 patients and you have done this tool. But yes, we have maybe, I don't know, about 50 participants, but we are seeing them over many months. And when you think about it, those patients can tell us a lot.
Yeah.
So we do something is that we also see them. We haven't only just done one take.
Yeah.
So they go, when they come back, we give them again and they draw.
Yeah.
So how does that help to have like routine pictures? Is there, because you guys thought of all this cool stuff. So is there any reason why, in a longitudinal way, why we have multiple visits to, and how do you put it all together?
Okay. First of all, let's use the example of the picture that was drawn
For
before.
for one of our actual
Yes,
patients.
the one
Okay.
of the actual patients.
Okay.
This was at the first meeting
Okay.
that we did this.
Yeah.
But this patient came back.
Yeah.
So when they drew their picture, if we're to compare the two pictures, they are not the same.
Okay.
Why? They have moved away from this to some other place, which could be worse or better,
better.
which has more insight if they are feeling better at how they are feeling right now,
Oh, cool.
after a number of months have passed. So it gives you a clear picture of this person's journey. So you get to understand them deeply.
Yeah. And
Yeah, but also something I've realized when we go for the normal sessions,
Yeah.
there is that pressure that you are supposed to answer
Say
a
certain
certain
box
way.
of
Yeah.
You're
yeah.
supposed to box it out. But like
Yeah.
when it comes to drawing, like it real pauses, it grounds you, and you just take time to feel through your emotions. Because I'm one of those people who use coloring and drawing as a
Wow.
coping mechanism.
Wow.
Oh, okay.
Yeah. So yeah, for me to get in contact with
Yeah.
such a tool that's actually able to do that has really been mind blowing,
Yeah.
and I just feel way better. And I just the tool is a way of getting
Therapy.
things out of my brain that I would struggle saying, that I don't have a language
Yeah.
for, and putting it somewhere.
Yeah.
I-
And also two things, I think. One, you can easily express yourself.
Yeah.
Because as you're drawing these pictures, we give you time. No one is going to stand over you to look at what you're drawing.
Okay.
Yeah,
Okay.
you give the person time, they draw. But also, as the person is drawing these pictures, there could be something they have actually never thought about that if they explained to you, Dr. Emma, you wouldn't understand. But with the pictures, like it was raining, and it made her feel a certain way.
Okay.
Yeah.
So it's again it goes back to many things that I keep thinking about. Are we capturing the things that matter to the patients?
Yes.
Are we asking the right questions? Are we using the right tools? Because I think she captured her. I have the same sentiment whenever I see this draw, write, and tell technique. I'm always thinking it's something maybe in the clinic everyone should sit somewhere as they wait to see the
Yeah.
psychologist or the psychiatrist. They draw. These days we give them checklists, right? And say, are you sad? Are you happy? Are you hungry? Have you eaten? Did you sleep? Okay? And that's such a narrow,
Yes.
right?
And the more I have come for the reviews, the more I know what to expect. He's going to ask if I've eaten. He's going to ask if I've slept. He's going to ask if I've done this. And I'll just go to do that, to finish the checklist and do my refill. So I don't...
Yeah, so I could ask, out of the research setting, any value you think? Because in my head, I think it's amazing. It's an amazing tool, and it has probably a lot of value. But do you think it's something that can work out of a research setting?
Yes, this is something that can be done routinely. For example, if you look at the tools, they're actually long. Some are long,
that's
some are short. This does not take a lot of time.
Yeah.
And also, like she said, people are just checking off with the list, but someone has to think about what they are putting down there. So one, it's easier to do, but two, you're getting the actual feeling. Someone can't pretend while doing this, because when they are telling you, and they will have to explain each picture.
True.
And how they're feeling at that moment. So I believe that if we are to use the draw, write, and tell method in routine care, it will be able to capture most of the things that we leave out, and then the patients will not have to take a long time in the clinic.
So MQ, Mental Health for Research, we have our next follow-on study, right? Ritah, Jakie, and I are going to submit an application. Yes?
Yes.
We are going to actually submit an application where we are going to take draw, write, and tell out of the research space and into the clinic space. An argument is very simple. It's depth.
Yeah. This is something someone can look forward to doing.
True. Would you, in a way, would you tell people to come in with the drawings? or now we are planning for the next grant.
So,
Would you tell people to come with the drawings, or would you tell them to draw while they're there? What do you think?
so you see, the other thing about also coming in to get help is the lines are long, and
True.
we have a lot of time well seated there.
Yeah.
You can sit for 1 hour or 2 hours. If someone told me, as you wait,
Yeah.
draw about what you are feeling, or
Yeah.
draw whatever you're going through, it would help me be more engaged, and I would be less irritable.
True.
We get so irritable during
I
the
can attest to that.
Yeah.
Yes. And
during
we
the wait
apologize,
period.
but how many clinical psychologists? So there's something very interesting. I tell people there are more mental health professionals in Cambridge. Cambridge is around Harvard than in Africa.
Wow.
So it's that bad. Psychiatrists in Uganda were less than 150 million people. Clinical psychologists, let's not even go there, because that's even a worse statistic. They don't even actually hire them by government, but luckily the Ministry of Health is changing that. But it's only this year, 2026, where the government says we actually need clinical psychologists in the hospital. So it's that bad. So yes, you're going to wait and wait long.
Yeah.
But that's a justification for our study, right?
Yeah.
If
If I could draw
Yeah.
while I'm waiting, it
Yeah.
would make the whole experience meaningful. And I remember there was a time I had to see a child psychiatrist because my psychiatrist wasn't available. And she gave me colors and something to color. I can tell you up to now, that has been one of my best sessions. I left so happy.
And she said actually this started in children, right?
Yes.
And then we just
mostly in
moved it
children.
to,
Yeah.
and maybe we could understand why we think it works in children,
Yeah.
but Ritah is actually telling us that it actually does work in adults.
Yeah,
and
but
older
also
persons.
to think about it, if someone has gone through an episode, we would think that they cannot draw.
Very good point.
Yeah, we
Because
would
that was my initial worry. So even if we wrote the grant and I was excited about it, that was my initial worry.
Yeah.
And actually that's why the LinkedIn post is one of my favorite posts, because it was this picture, actually it's actual picture. First time I was seeing it and I was like, wow, they can actually draw, they can actually communicate. And these were people experiencing a first episode of psychosis. So
Yes.
they were still unwell
Yeah.
to a certain extent, but they could actually draw and could communicate better in many ways.
Yeah.
So, again, for our future grant, I'm asking. So, do I need what skill sets, Jakie, would I need? Because that's an issue in the clinic. What do I need to do to be able to do this as a clinician? Are the skill sets that deep? Is there technology we can use? What's available? Yeah.
So one, since we said it's a qualitative method, one is, I think, for starters, you need a social scientist, surely, but not broadly, because again, if they have done their drawings, it actually makes your work as a psychiatrist much easier. Because by the time the person comes in, they already know what they want to tell you about. So your main aim would be trying to probe and find out more about these pictures and put them down with or without the social scientist. So long as, if it's routine and you've been trained, so long as you do it routinely, you can grasp the skills. It's not only the social it's been used in many other places for adolescents,
So it helps you get broader context.
Yeah.
Okay, so let's think in the mental health space where we get bashed left, right, and center for how broad mental health is. Okay.
Yeah.
Is this a good thing or a bad thing? Are we just adding more layers, or are we actually reducing the layers? What do you think?
I think you're reducing the layers.
Yeah.
For some reason, I think you're reducing the layers.
Because you're actually, one, you're not being put in a box to ask about sleep and appetite. Those things are important, but I think one of the things people don't like about coming from mental health services is that it's a bit too rigid. and too structured.
It's too structured.
Yeah.
It's too rigid. If I want my session to go a certain way, I know
tailored
what
to
to say.
Ritah.
Tailored to Ritah.
Yeah.
I will have crammed what to say over time. If I want,
So you guys deceive us.
let me tell you, there are times we
possible.
do. Yeah, it's very possible because if one of the things we do as heart-to-heart spaces is run safe spaces.
Yeah.
And I was once moderating a safe space, and this person was like, I just wanted the doctor to increase my dosage. So when I was going to the session, I knew how to increase the
What
symptoms.
to say
What
so
to
they
say.
can
What to
increase.
say so that they can increase. And I was like, and he increased? She was like, yeah, I've been doing this for 5 years.
So then that would mean that I would need you to draw maybe briefly before and then, in my head, just thinking what would happen. Okay. So what next? So you've maybe Jakie. So we've drawn, written, told. What happens after that?
Well, so we record. We have to have a recording of this and the narrative.
Audio recording.
Yes, audio recording
Okay.
of the narrative, but also this can also be in the a video recording for this.
Okay.
Yeah. So then we can match them, and then we analyze the data, what they have said vis-a-vis the picture, to come up exactly with what we want. But I think, to go back to your question of routine, we may not really need the whole recording, because for research purposes, there are many reasons why we are asking all those questions in the narrative.
For us, our question was really, we knew people were not coming back to care.
Yeah.
And we wanted to understand why they were not.
Yeah. So that journey of what happens at the hospital, you will be shocked at how much information you'd get from the drawings that is not in the questionnaires that you ask.
Yeah. That one came out clearly in the study.
Yeah.
So the drawings actually gave more depth and more,
It's more informative.
more informative.
More informative.
Yeah.
Flexible. You can actually, by the way, you can actually add or remove something. Let's say I'm speaking to Ritah with a picture, and I ask her, so how did this make you feel?
Okay.
Is there something you feel you want to add to your drawing? She could have remembered something. Or she
so it's allowed to add.
Yeah,
okay.
you can add, you can remove from your drawing. You could your first drawing could be something that you really didn't think about it, but as you get deeper into the drawing,
or in the discussion.
in the discussion, you remember something that you should have put on paper. So that can be added on there. Or something you want to remove. You say, no, I don't think this is speaking to what I wanted to explain. That can be removed.
Okay. Yeah. I think this is important for the funders, that there are many creative ways out there that we can actually interact with patients, and they should take a chance on all these new creative ideas. I always like being humble enough to say that I never used to believe this stuff. Anyone who knows me, I was the quantitative guy, right? This has humbled me. I never used to know lived experience. She knows. I'm now humbled. And I think the more I get involved in spaces that we are not in every day, we realize how limited we have been. And that sometimes that scares me. It's like, oh, well, then we need to do a bit more, okay? But I think, again, I think it's very important to thank the funder, right? Because we could have just said, well, there's a tool here that measures engagement. Yeah, we actually have a standard tool that measures engagement. But I don't even think I've even looked at that data yet, because this is really profound. So I think we really need to thank the funder. Yes, we're going to come with another proposal. I think we must say that now early. But we must thank the funder for taking a chance on us. I think we are doing this just not just to thank them, but to show that their faith in us has paid off. Because people are going to watch this and they're going to realize that they can use the same technique. Okay. So maybe in parting shots, what is your biggest take home from Draw, Write and Tell?
For me, my biggest take home is that if I want to understand someone's emotions, if I want to understand someone clearly, I think I need to give them time to express themselves openly. Yeah. So when they express themselves openly, then I can know how to intervene. Or because if, like she said, like Ritah rightly put it, if someone just comes and she knows how to do the checklist and what to say and she'll get medication, then the question to me is, am I helping this
am I
person
enabling?
or am I enabling?
Yeah.
Yeah. So my take home is that since this is in depth and we are looking for those feelings, the expressions, the creativity, then it is something I would really do.
Take home?
I think my take home is research is such a beautiful concept, because most times when you're undergoing through episodes of depression or psychosis or these things, you don't want to talk. The truth is sometimes we just don't want to talk.
That's very
Yeah.
true.
So if there is a tool that can help me put what I feel out there for a professional to help me without me necessarily talking and explaining myself, that's such a beautiful tool. And it's also something I would like to try and do on my own every week and say to myself, Ritah, can you draw how your week has gone so
Yeah.
that I'm really in touch in
That's
my
a brilliant idea.
emotions
That's a
and I'm
brilliant idea.
Yeah.
You know, we
more
have mood chats.
self-aware.
We have mood chats.
Yeah.
So it's the other day I was talking. Dr. Kenna has a Kenna visual inventory for depression, and it's screening for depression using pictures. But now when you think about it, a mood chart, our mood charts are Tuesday, high, low, normal. You tick, right? But if I told you this week, just once a week, just draw.
Just draw.
Yeah. Okay.
But then also what that does, especially for someone who's fighting depression, it gives you like a track to know that it won't always be dark. You won't always
can actually
be low.
keep tracking.
Yeah, you
Yeah.
can actually keep track and say, on page 3, I had a good day.
Yeah.
So
So that's the way
To
the writing.
reflect.
That's where
yes.
the writing comes
Yeah,
in.
so the reflection part of
Yeah.
it is also very, very beautiful. I love it.
I actually love it. So I think for me the take-home message is that we don't really know enough about our patients. And we as clinicians have to start being a bit more humble, and we have to start figuring out better ways to talk to our patients. I think for me it has been a humbling experience. So, okay, so this is the end of this podcast. Again, it's my first time moderating. I've enjoyed it.
You did great.
I did well, I think. Yeah, thank you.
You did very well.
And I was in a nice shirt as well. Again, much appreciation to the funders. So we don't take it for granted. Actually, if you go to their website, there's a point where you can donate and the donations allow them to help people like us who they take a chance on us. And I think in a way they don't know it because they haven't yet watched the podcast, but when they do, they have opened a Pandora's box for what is possible in funding mental health research. So we'd like to thank them. Like to thank Ritah, Auma, Heart Spaces, Jakie, Lydia, the Draw, Write and Tell expert in Uganda, Emmanuel Mwisiga. I do many things. Today I haven't said it, but I'm actually the president of Uganda Association of Psychiatrists. And I think this will be an important discussion for mental health in general about how much information is out there that we are leaving on the table with our patients. So I hope it can generate a lot of conversation and much greater work. And hopefully Jakie is available to do all these draw, write, tells. And I'm going to improve my drawing skills. So many good things are going to come out of this.
Yeah.
So thank you very much. Thank you, Ritah. Thank you, Jakie.
And thank you for having us.
Thank you, everyone watching. Stay well.
What's the power of a gift? We'll tell you. MQ receives donations from people all over the world who care about mental health. Our collective goal is to better understand mental illness through research, with hope of one day preventing it altogether. We invest these gifts into research grants and fellowships at many of the world's leading universities. There, the brightest minds meticulously research mental illness. The result? Life-changing breakthroughs. Every gift gets us there, and every person like you can make it happen. You give to MQ, we give to researchers. They give breakthroughs. Join us in this journey by giving today.